Hey, my name is Jerry Johns. This is my wife Marcia. We have been dying to do this video because we have just had an experience with Dr. Gulani that we're both still shocked about and thrilled about. Just give you a little background. I've had keratoconus, a severe corneal disease, for over 20 years, and I've had multiple surgeries on my eye, and didn't know what to expect. I kept hoping some of them would work a little bit, but as it went on, it kept getting worse and worse and worse, and I'd have another surgery and it'd get worse. I just got to the point where I couldn't drive, I couldn't do my job. I'm a pastor and I used to be a television director, so either one of those careers, you need your vision really badly. So Marcia and I finally found Dr. Gulani. Some people had recommended him. We live up in Georgia, not too far from Jacksonville, and I got to tell you, we've been shocked at the difference that we've been treated in Dr. Gulani. First of all, you don't have to wait for an entire day in the waiting room. I used to sit for hours, get there at 11 o'clock, see the doctor at 5. And I thought that was the norm.
Usually I feel in the way, but I always like to come in on the doctor visits. I usually feel in the way. I'm the wife. The minute I came in, I said, I'm the wife. Is it okay if I sit in? Come in. Dr. Gulani said, yes. He said, I treat families. And he talks to me as much as he talks to Jerry to make sure that we both understand and we're both involved in the decision making.
You guys, if you've ever been to the eye doctor, if you've got any kind of problems with your vision, what do normally? They put you back there in the room, somebody comes and sees you, they examine your vision, and they leave you sitting back there, and finally the doctor comes in, you get like 3 minutes. Well, we were shocked. Here comes Dr. Gulani. He does the refraction himself, and I'm like, what? The doctors?
That was a first.
And not only did he do it, it was the best refraction I've ever had in my life. I mean, the guy nailed it the first time. He came in, he was ultimate professional. I mean, and he looked at my eye and he goes, oh, no, this is not going to do. We're going to fix this. And I was like, wow, remember? We went home shocked that a doctor had spoken to us like that, like we were actually real people. And
right.
And then he lets it, I don't know how else to say this, but and I told him this phrase, Dr. Gulani, I say, Dr. Gulani, you treat me differently because the patient is the instrument. In other words, he didn't depend on all this technology and everything and tell you, well, you should be seeing now. Dr. Gulani's asking me, how's that? Do you see that now? And I would say, yes. And he would say, how about this? This should be working. Yes. And every time it kept getting better and better and better. So we were just stunned at how different he is. First of all, the man is a pioneer. He's a visionary. He's not satisfied. You think about how many people in this world are just satisfied with the status quo. Dr. Gulani is not satisfied with the way eye care is going. I can tell that he's not satisfied with my vision. He's going to make it as good as it possibly can be. When I walked in the door, I had very poor vision, and he's already done so much for me. And I would say he's like Mayo, like the Mayo Clinic here in Jacksonville. Mayo had a vision. He was not satisfied with the way things were. And I see Dr. Gulani as somebody like that, somebody who not only is going to help me as a patient, but he's going to help train people in the future to help millions of other people to have better vision.
Didn't you say that he was trying to correct the myopia of the industry?
I don't know if any physicians will watch this, but we're not patients. We're people. Mm-hmm. We know our bodies and we can help you. You've got the training. Dr. Gulani works with the patient, and I feel like that he's helping other doctors to see, when you walk in, those people need your help, but they also are people, and you can talk to them like a person, and he's just treated us. I've never been treated that way.
That's the way we have felt from the moment we entered the office. Not just Dr. Gulani, but the entire staff.
Yeah.
We feel more, first of all, we feel more like peers with the doctor than just doctor-patient. We feel that we are working together, and also we feel like family with the entire staff. I love the way they make surgery day a celebration. The girls in the front office or the techs or whoever is able to come to the back, will come back and watch the
Yeah.
surgery, or some of them sat with me to support me while I was watching the surgery. And I've never experienced that in any type of doctor's office or setting.
You know what he said, and I just thought of this while you were talking. You know what Dr. Gulani said to me the first time I ever came in here? And I almost started crying. He says, it's not your fault that you can't see. See, I've been made to feel like that I did something wrong because I have keratoconus and I can't see anything. I'm not putting enough drops in my eyes, or I didn't do this, or I didn't do that. And Dr. Gulani says, this is not your fault. We're going to fix this. I almost started crying because that's all we want is help. You know, when we come to the doctor, everybody. I can't say enough about this man. I mean, he is he's not like anybody I've ever met in a doctor's office, and I'm going to trust him with my vision. And if you're watching this, you need to get on the phone and start making a call and call Dr. Gulani and let him help you too. Thanks so much.